Welcome back to Mental Health Now. I'm Dr. Ramses Vargas, board certified psychiatric nurse practitioner, and I'm here to talk to you about establishing boundaries. Now, ideally, we want to establish these boundaries when we first meet the patient because after a few appointments, it's too hard to go back on certain things. What are those certain things? What the patient can expect from you and what you can expect from them. The three most important things for me are controlled substances, medication changes, and how we're going to communicate. And I already have something that I typically tell patients that kind of encompasses all of those things and kind of lets them know a little bit about me, how I practice, and again, what they can expect. This is what I tell patients. 90% of the time, I'm going to do whatever you want as far as medications. You're the one taking the medications. You're the one that knows the effects. However, there is evidence that says certain things can't be used for a long time. I'm going to follow the evidence. If I see that there's any red flags, like you are needing refills a lot earlier than we're scheduled for, if you're seeing other providers to receive medications or medication bridges or medications that you don't tell me about that are controlled substances, that's another major red flag. And the last one would be communication. How would we talk about that? You would contact my office and I would get back to you typically within a business day. The patient, a understanding of how they can talk to me, what's my expectation with medications, and that they know that they can ask me or any new medication that they might get influenced by a commercial, social media, YouTube, and they want to try, like Cobenfy or Trintellix, something like that. These are newer medications. It can be kind of difficult sometimes is with controlled substances, multiple controlled substances for like pain management, where they're seeing another provider that's treating that pain. That's where it becomes complicated, where the patient must communicate with you, with your clinic, and make sure everyone's on board. We also need to do our due diligence and make sure that we're checking the PMP in our state to be able to compare and see what's being filled versus what our client is telling us. Another important thing to consider when establishing boundaries and care is letting them know that you're always going to provide your best opinion and your best recommendation. And that sometimes the patient may see things differently, and that's okay. They can always have a second opinion. For example, if someone is trying to reduce cannabis use and I'm prescribing medications to treat their anxiety or depressive symptoms for why they smoke, but they're not changing much of their day-to-day of their use, then I would recommend psychotherapy. And then if they're not participating in psychotherapy, then I would tell them, I'm here to kind of just waste my time if you just want me to manage medications and not participate in other treatments that are more of a gold standard to truly help you with your goal. I feel that these conversations are necessary and also can be done tactfully and don't need to upset the patient, upset yourself, stigmatize them. You just set clear boundaries from the beginning and you'll be set later on. That way you can always reference back and say, hey, this is what we had talked about. You kind of already know. The other thing that some companies require you to do is sign a consent form specific to treatment, that you will follow that treatment. I have mixed reviews about that. I've had several patients come to me saying that they didn't want to sign certain contracts with clinics. Completely understand that. And that it was sometimes depending on what that clinic recommended. It's kind of like what I'm saying right now, that if that patient is not doing therapy and they're just taking my medications, but they're not getting better, then to me it would be, what's the point of seeing me? So I can see that. That's why I say it's mixed, but I wouldn't make the patient sign anything. I would just tell them that up front. For controlled substances, we do need to meet annually, at least once a year in person. So that also is a good time to re-establish those boundaries and kind of those expectations from there. Hey, if I need you to do a urine drug screen, please do it. Otherwise, I can only continue the medication for the next 30 days. So you can be open, clear, and you don't need to be mean about it. So I hope you enjoyed learning a little bit about how I do things and the way that I establish boundaries. You can do this for many other things like labs. You could tell them, hey, I can't continue to prescribe medications until, we do your labs. This can be applied into psychotherapy, into different things. But at the core, it's about saying no, but this is why, not just, saying no or something. There's clear communication and they know what to expect. As always, thank you for watching. Like, comment, follow, subscribe, share. Thank you so much for everything. And if you have any questions, put them in the comments. That's the best way to get your question answered. As always, thank you for watching, and I'll see you on the next one.